I am Luisa Vinciguerra, International Inner Wheel Passport Director. I would like to express my appreciation to International President Mamta Gupta for including me in the Cease Cervical Cancer campaign, which has been active since December 10, 2024, in all countries where Inner Wheel operates. This campaign, along with its various initiatives, is one of the President's primary objectives. It aims to raise public awareness about the critical importance of cervical cancer prevention by utilizing the vast Inner Wheel network. We are dedicated to considerably increasing vaccination rates to ensure that future generations are protected from the papillomavirus. This ambitious goal is also pursued through performances such as Voices of Subject Matter Experts, which offer high-quality informational videos. We are delighted to have the opportunity to interview Dr. Federica Fassio, a distinguished gynaecologist. We extend our gratitude to her for agreeing to participate and for her invaluable insights. Now, let us move forward with her presentation. Dr. Federica Fassio is a highly regarded specialist in gynecology and obstetrics, currently employed at the ASL Città di Torino. She has gained extensive experience during her training at the University of Turin, particularly at the Sant'Anna Obstetrics and Gynecology Hospital. In her position, she has leveraged her expertise in a dynamic environment that promotes her professional development. Her career is further enriched by significant experience in scientific research and publication. Her dedication and constant commitment have established her as highly qualified and respected professional in her field. Let's explore the core of the interview by addressing the initial question. Dr. Fassio, could you explain what human papillomavirus is and how it is transmitted?
Human papillomavirus is an infectious virus that affects humans with over 200 known serotypes, and it is highly prevalent in the population. Most human papillomavirus infections resolve on their own and show no symptoms. However, persistent infections can lead to cervical cancer in women. Cervical cancer occurs in the cervix, which is the gateway to the uterus from the vagina, and it is the fourth most common cancer among women. Nearly all cases of cervical cancer are linked to infection with high-risk human papillomavirus types. In 2022, it is estimated that 660,000 women worldwide were diagnosed with cervical cancer, and about 350,000 women died from the disease. Human papillomavirus can also cause other forms of anogenital cancer, head and neck cancers, as well as genital warts in both men and women. The infection is mainly transmitted through close contact during sexual activity, even if not fully penetrative, with an infected individual. In many cases, a person can acquire the infection and remain a carrier of the virus for an extended period without realizing it. Certain risk factors such as smoking, a compromised immune system, a high number of sexual partners, and obesity can increase the likelihood of developing related diseases.
This comprehensive overview emphasizes the profound influence of HPV on global health, especially its association with cervical cancer. Could Dr. Fassio please elaborate on the importance of HPV vaccination in preventing cervical cancer and other related disease?
Common hygiene practices and condom use are effective tools for preventing papillomavirus infection, but they are not completely foolproof. The vaccination is the most cost-effective public health strategy to fight cervical cancer. The current vaccines protect against the 9 most dangerous human papillomavirus types and are highly safe and successful. The vaccine contains virus-like particles that mimic the structure of the virus, but do not contain infection genetic material, meaning they cannot cause an infection. Once given, the immune system identifies this particle as extraneous and starts producing specific antibodies. The body then creates an immune memory storing these antibodies. As a result, if the body interacts with the actual papillomavirus later, the immune system can react quickly, preventing the virus from causing an infection. The antibodies produced by the vaccine block the virus before it enters skin or mucous membrane cells, thereby preventing infection and the development of related diseases. Mass vaccination helps reduce the spread of the virus in the population, providing protection even to those who are not vaccinated. In addition to vaccination, the World Health Organization recommends cervical screening for precancerous lesions, which, when detected and treated, can also prevent cervical cancer.
Dr. Fassio, your answer highlights that vaccination is the most effective strategy for protection. It safeguards individuals while also fostering community-wide immunity, which in turn diminishes the overall transmission of HPV and its associated disease. Additionally, could you please clarify the recommended recipients of the HPV vaccine and the optimal age for administration to ensure maximum effectiveness?
The vaccine is recommended for both boys and girls, typically starting at ages 11 or 12, before the onset of sexual activity, because it provides greater protection before any potential exposure to the human papillomavirus. If someone wants to get the vaccine, they should speak with their medical provider to discuss their option and decide the correct timing and dose plan. Vaccination is also important for boys, given the scientific evidence showing an increased risk of cancer in men as well, and because they can be carriers of the virus and infect their sexual partners.
We agree with you, Dr. Fassio. Vaccinating both boys and girls at an early age is crucial for ensuring optimal protection. Now, addressing the question, is the HPV vaccine safe, particularly for those who are hesitant about vaccinations?
Yes, the vaccine is very safe. It has undergone extensive testing in clinical trials and has been continuously monitored for safety since its introduction. Like all vaccines, it can cause side effects, but these are typically mild, such as pain at the injection site, headache, or fever. So, in conclusion, we can say that we have the technical, medical, and policy tools to eliminate the issue of human papillomavirus-related problems.
Thank you for your insightful response, which spotlight the safety and efficacy of the HPV vaccine. It underscores its minimal side effects and illustrates that with the right medical tools and strategies, we are well equipped to tackle HPV-related challenges. I have one final question. Dr. Fassio, how would you assess the overall effectiveness of the Cease Cervical Cancer campaign across the inner wheel globally, given the diverse countries and cultures involved?
I think this international awareness campaign is very important. Educating people about how to prevent cervical cancer is essential in reducing the number of cases. By informing people about the risks, the available vaccines, and the importance of regular screenings, we can save many lives. Additionally, a global campaign helps ensure that people around the world, especially in areas with limited access to healthcare, can benefit from these resources. Education and prevention are the best ways to eliminate cervical cancer.
Dr. Fassio, I sincerely appreciate your enlightening responses and your generous sharing of expertise. Your knowledge and attention to the cause have provided invaluable clarity, enhancing our understanding of the importance of prevention and awareness in the fight against cervical cancer. Going to the end, I would like to extend my gratitude to our International President Mamta for her unwavering commitment and hard work in facing numerous critical issues. Her continuous efforts are truly commendable and inspire us all to make a lasting success. Thank you for your kind attention.